it all depends on where you get your news and where you get your information, right? I think there's certain social media outlets, and people, I mean, anyone can post on social media, right? And so if you're listening to, Nicki Minaj,
yes,
or people like that, then you're going to see things that, aren't likely, validated by the science. So I always look to, the trusted entities like the Center for Disease Control, the World Health Organization, National Institutes of Health. And what people need to know is that there's a lot of data that's collected, from people who are vaccinated. If you go get vaccinated, they'll give you a sheet that talks about a system that the CDC has in place to monitor your symptoms. So I did it, my kids did it, my wife did it. So they'll send you a text and say, how are you feeling today? And I'll say, I feel a little tired, or I have pain in my arm. So they're collecting this data from as many people as they can. And so there's a good system in place for collecting that. And so really what that data shows is what I just talked about before, that the majority of people, have that pain and swelling at their injection site and the kind of natural flu-like symptoms, afterwards. And there's also a system in place to monitor for serious adverse effects from the vaccine, like deaths or myocarditis or heart attacks and things like that. It's called the Vaccine Adverse Event Reporting System. And so, we do know that people have reported to that system, but serious side effects have been shown to be extremely rare from the vaccines. And so I think that a lot of times people make stories up and it kind of gets out there. And so I think the side effects from the vaccine have definitely been fabricated a bit. But right now, everybody's got a voice. Like, everyone has an audience on social media, and whatever they say, sometimes people believe it. And so I think where you get your information is key to what type of information you get. But I think that the best approach is always go to those trusted sources of information.